hospitals have been working on patient safety pretty actively for the last 15 years, in particular after the Institute of Medicine report came out. The Joint Commission National Patient Safety Goals were a real force in starting to move hospitals along as well, and I think hospitals have been doing a lot around culture, around identifying safety events, around better analysis of events. So there has been lots of work, and I think we have made some progress. That being said, I don't think we're anywhere close to being done. There's plenty more that we need to do around culture, around reporting, around redesigning our systems. So, we made progress, but still a long way to go on the hospital side. In the beginning, NPSF was all about awareness, making sure people understood, hey, we have a problem in patient safety. Over time, especially through its think tank, the Lucian Leap Institute, it's been thinking a lot about what are the key issues in safety where we need to put focus. So issues like medical education, issues like transparency, issues like patient engagement. These are all things that NPSF is trying to promote out to the world that will be key factors to improve patient safety. And then going forward, I think we're going to be doing much more also about, well, how do we operationalize this? It's great to say we need to do patient engagement, but how do we actually do it? And thinking about, can we disseminate tools and tactics for doing that? One thing I think attendees will be talking about is accountability, and to what level we take accountability in terms of dealing with providers who maybe don't want to follow safety best practices. There was an interesting debate in the opening plenary about that topic. There are tracks about patient engagement and joy and meaning in the workplace. Particularly joy and meaning, I think, is an area where a lot of hospitals have not put as much attention, which is workforce safety. And so we have a whole track on that, hopefully with some really practical examples of how to get started on workforce safety. We actually also provided a checklist to attendees about how to get started on that work as well. And all of our tracks have lots of examples of best practices that we're hoping people can take back to their organizations and start to disseminate at their own places. I think NPSF's next steps are going to be about how do we operationalize some of these great ideas that we've had over the years around patient engagement and joy and meaning in the workplace. So that's one big area. The other is, I think there's going to be new emerging areas that we need to make sure that we are really on top of and leading the way on. So one is ambulatory safety. You asked about hospital safety, which, as I said, we've been spending a lot of time and effort on over the last 15 years. There's a lot of issues in the outpatient setting that we need to identify and start to think about how to address. And the outpatient setting is very diverse. It's not just clinics, it's surgical centers, nursing homes, a whole range of settings. So we need to better understand what we can do in those settings. And the other big area, I think, is around health information technology and patient safety. We have spent a lot of time convincing people to implement technology, and now they're implementing it, which is great, but now we need to make sure we're implementing it well so we get the safety benefit without potentially having harm from poor implementation. So I think those two areas are future areas of focus for NPSF.